An eye-opening look at what the state counts as a COVID case. WRTV Investigates Kenney has been digging into all of these numbers and shares with us tonight what she uncovered.
When you think of a COVID-19 hospitalization, you might think of someone who's very sick because they have COVID-19. But we found that's not always the case. State data does not differentiate between someone who's hospitalized because of COVID-19 symptoms and someone who's hospitalized for other reasons and also test positive. As COVID-19 maintains its grip on Indiana, state officials focus on trends when it comes to cases and hospitalizations.
The number of people hospitalized with COVID has increased more than 700% since late June. Our healthcare workforce is depleted.
More than 3,000 people are hospitalized in Indiana with COVID-19, but state data does not distinguish between hospitalized patients with COVID or because of COVID.
There probably are a few people out there who may be completely asymptomatic, who came into the hospital with something else and end up testing positive because the hospital's testing everybody. But that's very, very few numbers.
Dr. Brian Dixon is the director of informatics at the Regenstrief Institute in Indianapolis, which advises the state health department on data trends. He sees the numbers behind the scenes and emphasizes that COVID-19 plays a role for most patients who are counted as a COVID-19 hospitalization.
I would say in the state of Indiana, about 75% of people who are in the hospital are they're sort of hospitalized, for COVID as their primary diagnosis. There are some people whose primary diagnosis, though, is pneumonia or respiratory failure or fever, for example, and they came in with that as kind of the main thing that they were reporting coming into the hospital for, but then they later tested positive for COVID.
Regenstrief also reports COVID-19 hospitalizations on its own dashboard. They also include patients who test positive for COVID-19 after arriving at the hospital for a seemingly unrelated illness.
What do you say to people that might say, well, you're including these other hospitalizations just to inflate the numbers?
These numbers are not inflated for any kind of political agenda. They really reflect the number of people in the hospital at any given time who have COVID-19 or admitted while positive with COVID-19.
Dr. Dixon also says breaking out the data could be confusing to the public and in small communities could potentially identify someone's individual diagnosis.
So that's one of the reasons why we don't do it.
Indiana hospitals provide hospitalization numbers to the state health department, which reports them on the state's dashboard. Breaking down the data would be time-consuming to hospitals that are already struggling with overwhelmed emergency rooms. The Indiana Hospital Association tells us whether a patient is hospitalized with COVID-19 or because of COVID-19, treatment requires immense healthcare services and resources, which are at a scarcity. Indiana hospitals remain laser focused on delivering the care our patients and communities depend on during this unprecedented time. IHA also emphasizes this distinction is not relevant to the main issue facing the public. Indiana hospitals are overwhelmed with the highest number of patients on record and have reached a state of crisis with dwindling capacity left to care for patients. Dr. Dixon says if a patient tests positive while in the hospital, it's usually within 3 days of admission. He emphasizes developing COVID-19 while in the hospital can still have an impact on the patient's health.
What's the one thing you want people to keep in mind about these numbers?
As always, we try not to focus on any specific count for any given day. What we're really looking for are trends. And when we see these numbers going up, it means that we're still we have rising disease burden in the community.
The bottom line is the healthcare system is overburdened right now, and COVID-19 is contributing to that. COVID-19 patients make up 25% of all hospitalizations. Working for you, Kenney, WRTV.
And Kara will keep asking questions. The Indiana Department of Health turned down our request for an on-camera interview. But in a statement, the agency explained that their hospitalization metrics include the COVID hospital census. Now, this is the total number of COVID patients in the hospital at any given time as reported by each facility. It also includes the COVID PUI census. Now, PUI stands for Persons Under Investigation. This involves individuals who hospitals believe have COVID, but who do not yet have a positive test result. And lastly, COVID hospital admissions. This data is pulled directly from the Regan Street Institute and is the number of individuals who have been hospitalized and tested positive for COVID-19.